Piles, also known as hemorrhoids, are swollen veins in the anal and rectal area that can cause discomfort, pain, itching, and bleeding. The veins in this area can become swollen and inflamed due to increased pressure, causing them to stretch and bulge. There are two types of piles, internal and external. Internal piles occur inside the rectum and are not visible, while external piles occur outside the anus and can be seen and felt. Internal piles are typically painless but can cause bleeding during bowel movements. External piles can be painful and may cause discomfort, itching, and bleeding. The most common cause of piles is increased pressure on the veins in the rectal area. This can occur when you strain during bowel movements, are pregnant, or overweight. Other factors that can contribute to the development of piles include sitting for prolonged periods of time, lack of fiber in the diet, and certain medical conditions that affect blood flow. Symptoms of piles can vary from person to person, but they typically include pain, itching, and bleeding during bowel movements. Piles can also cause discomfort and swelling in the anal area. These symptoms can be uncomfortable and interfere with daily activities. Treatment for piles may involve lifestyle modifications, such as increasing fiber in the diet, drinking plenty of fluids, and avoiding prolonged sitting or standing. Over-the-counter creams or ointments can also help to relieve pain and itching. For more severe cases, prescription medications or surgical procedures may be necessary. Treatment for piles can vary depending on the severity of the condition. For mild cases, over-the-counter creams or ointments can be used to relieve pain and itching. These products typically contain local anesthetics, vasoconstrictors, or anti-inflammatory agents. Fiber supplements, such as psyllium, can also be helpful in softening the stool and reducing the discomfort associated with piles. Drinking plenty of fluids and maintaining good hygiene can also aid in the healing process. For more severe cases, prescription medications, such as hydrocortisone creams or suppositories, may be necessary to reduce inflammation and relieve pain. If bleeding occurs, iron supplements may be recommended to prevent anemia. In rare cases, surgery may be necessary to remove the piles. Surgical procedures may involve stapling or removing the affected tissue. These procedures are typically reserved for cases where other treatments have failed or when the piles are causing severe discomfort or bleeding. Prevention measures that can help reduce the likelihood of developing piles include maintaining a healthy weight, avoiding prolonged sitting or standing, practicing good hygiene, and staying hydrated. Adding more fiber to the diet, exercising regularly, and not straining during bowel movements can also help to prevent piles from developing. By following these measures, you can keep your anal and rectal area healthy and avoid the discomfort associated with piles. It's important to consult with a healthcare professional before starting any treatment for piles. They can evaluate the severity of the condition and recommend the best course of treatment for your individual needs. With proper treatment, piles can be effectively managed and symptoms can be relieved,